GOMEKLI mirdametinib is a prescription medicine used to treat adults and children 2 years of age and older with neurofibromatosis type 1 (NF1) who have plexiform neurofibromas (PN) that cause symptoms and cannot be completely removed by surgery. It is not known if GOMEKLI is safe and effective in children under 2 years of age. Please see important safety information later in this video and patient information available on GOMEKLI.com. In this video, we'll talk about how to work with your care team to manage common side effects and offer tips that may help throughout treatment. The most common side effects with GOMEKLI are diarrhea, nausea, muscle, joint, and bone pain, and vomiting. Some adults may also experience tiredness, while some children may experience headache, stomach pain, and skin redness, swelling, or pain around the fingernails and toenails. GOMEKLI can cause other side effects, including some serious side effects, which we will go over in this video. Most of the side effects associated with GOMEKLI have been shown to start early in treatment, but it's good to know that there are things your care team can do to help address them. In the single-arm clinical study of GOMEKLI, one of the most common side effects seen among both adults and children was rash, which can be severe. This could be a flat skin rash, raised bumps on the skin bumps that look like acne, skin redness, itchy rash, or peeling skin. There are things you can do to help address skin-related side effects. These include taking daily baths and using mild cleansers and skin moisturizers at least twice a day to prevent dryness. You may also consider avoiding products that could dry out or irritate your skin. Your care team may also provide medication to help with the rash or refer you to a dermatologist for additional care. Gastrointestinal side effects such as diarrhea, nausea, vomiting, and abdominal pain are also common in people who take GOMEKLI. There are certain tips you can keep in mind to address stomach-related side effects, such as avoiding fried, fatty, or spicy foods and increasing your fluid intake. If you continue to experience issues, consult with your care team for further treatment options. Depending on what you're experiencing, your care team may interrupt, reduce, or permanently stop your GOMEKLI treatment. It is important that you take GOMEKLI as directed by your healthcare provider. Because GOMEKLI can cause serious side effects, including eye problems and heart problems, your care team will regularly assess your eyes and heart before and throughout treatment. Before taking GOMEKLI, make sure to tell your healthcare provider if you have any eye or heart problems. Your care team will also want to run routine lab work, including blood tests. These assessments are important because they help your care team see if anything is going on that needs to be addressed. That's why it's vital to stay on top of appointments. But remember, if you're experiencing anything out of the ordinary, you shouldn't wait until your next appointment to let your care team know. The key to staying on top of side effects is being proactive, open, and honest with your care team. They won't know how to help you if you don't speak up. The GOMEKLI Treatment Journal can make things easier. It includes weekly templates so you can record how you're feeling, jot down general notes, and save any questions you have for your care team. Once you start GOMEKLI and are enrolled in SpringWorks Care Connections, the journal will be sent to you as part of your GOMEKLI Starter Kit. You can also find it on GOMEKLI.com. GOMEKLI.com also has other helpful resources in case you have questions about treatment. Additionally, once you're enrolled in SpringWorks Care Connections, our team of nurse advocates will be available to provide support and help you stay on track with treatment. Managing side effects is a team effort involving both you and your care team. Keeping an open line of communication is key to ensuring you have the best experience possible with GOMEKLI. If you have any questions or concerns, please reach out to your healthcare provider. Keep watching for additional important information on side effects with GOMEKLI. Important safety information. Before taking GOMEKLI, tell your healthcare provider about all of your medical conditions, including if you have eye problems, have heart problems, are pregnant or plan to become pregnant. GOMEKLI can harm your unborn baby. Females who are able to become pregnant. Your healthcare provider should check to see if you are pregnant before you begin treatment with GOMEKLI. Use effective birth control, contraception, during treatment with GOMEKLI and for 6 weeks after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with GOMEKLI. Males with female partners who are able to become pregnant use effective birth control contraception during treatment with GOMEKLI and for 3 months after your last dose. Tell your healthcare provider right away if your female partner becomes pregnant or thinks she may be pregnant during treatment with GOMEKLI, are breastfeeding or plan to breastfeed. It is not known if GOMEKLI passes into your breast milk. Do not breastfeed during treatment with GOMEKLI and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I take GOMEKLI? Take GOMEKLI exactly as your healthcare provider tells you to take it. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with GOMEKLI if you develop certain side effects. Take GOMEKLI twice a day, about 12 hours apart, for 21 days, followed by 7 days off treatment to complete a 28-day treatment cycle. Your healthcare provider will decide how many treatment cycles are right for you. Take GOMEKLI with or without food. GOMEKLI comes in 2 different dosage forms, GOMEKLI capsules and GOMEKLI tablets for oral suspension. Your healthcare provider will decide the dosage form and dose of GOMEKLI that is right for you. If you take GOMEKLI capsules, swallow each capsule whole with drinking water. If more than 1 capsule is required, swallow 1 capsule at a time. Do not open, break, or chew the capsules. If you take GOMEKLI tablets for oral suspension, either swallow each tablet for oral suspension whole with drinking water. If more than 1 tablet is required, swallow 1 tablet at a time. Or disperse the tablets for oral suspension in drinking water to make a liquid, suspension, before you take or give GOMEKLI. See the instructions for use that come with your medicine for instructions on how to prepare and take GOMEKLI tablets for oral suspension. If you miss a dose of GOMEKLI, skip the missed dose and take your next dose at your regularly scheduled time. If you vomit at any time after taking GOMEKLI, do not take an additional dose. Take your next dose at your regularly scheduled time. What are the possible side effects of GOMEKLI? GOMEKLI may cause serious side effects, including eye problems. GOMEKLI may cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment with GOMEKLI. Tell your healthcare provider right away if you get any of the following signs or symptoms of eye problems: blurred vision, loss of vision, other changes to your vision. Heart problems. GOMEKLI may lower the amount of blood pumped by your heart, which is common in children during treatment with GOMEKLI and can also be severe. Your healthcare provider will do tests before you start GOMEKLI treatment every 3 months during your first year of treatment, and then as needed to make sure your heart is working properly. Tell your healthcare provider right away if you get any of the following signs or symptoms of heart problems: coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Skin problems. Skin rashes are common with GOMEKLI in both adults and children and can also be severe. GOMEKLI can also cause hair loss, alopecia. Tell your healthcare provider if you develop any of the following signs or symptoms of skin problems: flat skin rash, raised bumps on the skin bumps that look like acne, skin redness, itchy rash, peeling skin. The most common side effects of GOMEKLI in adults include diarrhea, nausea, muscle, joint, and bone pain, vomiting, tiredness. The most common severe abnormal blood tests in adults include an increased enzyme called creatine phosphokinase, CPK. The most common side effects of GOMEKLI in children include diarrhea, muscle, joint, and bone pain, stomach, abdominal pain, vomiting, headache, skin redness, swelling, or pain around the fingernails or toenails, nausea. The most common severe abnormal blood tests in children include decreased white blood cell neutrophil counts and increased CPK. GOMEKLI may cause fertility problems in females, which may affect your ability to have children. Talk to your healthcare provider if you have concerns about fertility. These are not all of the possible side effects of GOMEKLI. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information and instructions for use, available on GOMEKLI.com. Thank you for watching.